There's more evidence tonight of the intense pressure on the NHS as COVID-19 infections continue to rise right across the UK. The London Ambulance Service says Boxing Day was one of the biggest ever days in its history, with many calls due to the usual winter pressures but compounded by the coronavirus. And in Scotland, doctors say health services could be overwhelmed if the relaxation of COVID restrictions for Christmas triggers a surge in cases. The warnings come as the latest government figures show the number of new infections is increasing. There were 30,501 new cases recorded in the latest 24-hour period. But the true number is likely to be higher, as some parts of the UK haven't reported their numbers. 316 deaths were recorded of people who died within 28 days of a positive COVID-19 test, taking the total across the UK to 70,752. With more on the strain on the NHS, here's our correspondent, Sangita Myska.
Hospitals and other frontline services are under mounting pressure tonight in some parts of the UK. That's the warning from the NHS. The BBC has learned that student paramedics and 2 other ambulance services outside the capital have been called in to assist after a sharp rise in calls. The London Ambulance Service says that yesterday, Boxing Day, was one of its busiest ever, with calls up by more than 50% compared to last year.
I never want to say that the NHS is going to be overwhelmed, because we see the NHS being endlessly innovative and ingenious in how it can actually manage to spread incredibly thin resource. But I think it's worth remembering that things are incredibly challenging.
Meanwhile, the Welsh Government has described the NHS there as stretched to the limit and working to full capacity. Annual illnesses, staff shortages and the rapid spread of the new coronavirus variant yesterday led Cardiff and Vale University Health Board to tweet this stark appeal. Our critical care department is urgently looking for assistance from medical students and other staff groups who've previously supported proning patients.
The art of proning patients, and that is about moving patients when they're in intensive care from their backs onto their stomachs and vice versa. And this process is quite heavy lifting. It involves 5 to 7 individuals.
Medical students and others answered the call in large numbers, and the Health Board later tweeted that while staffing remained challenging, the critical care unit remains open. In Scotland, clinicians are issuing more warnings, this time that the NHS could be overwhelmed. Mainland Scotland is now in Tier 4 restrictions. The new, faster-spreading variant, combined with the temporary easing of restrictions on Christmas Day, could, they say, have created the perfect storm for an NHS that is already overstretched.
Sangita, there are so many people hoping the rollout of vaccines will help with all this.
Look, undoubtedly, the National Immunisation Programme will have a part to play in solving this problem. We already know that we've got over 600,000 people in the UK immunised already. And of course, we've also heard the news today that the Oxford scientists are hoping that their vaccine will be approved this week for use. But Clive, this is a complicated picture. There are 3 factors at play that have created this pinch point. One is NHS staff themselves who've been treating COVID patients who've picked up the virus and are themselves either self-isolating or shielding. We've also got the usual winter illnesses that at any time will put pressure on the NHS. And finally, we have this highly infectious variation of the virus, which is now spreading across the UK. So what does that mean? Well, it means that in the short term, the NHS will remain under huge pressure.
OK, Sangita, thank you. Sangita Myska there.